Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about human rights and government policy. All right, welcome back, everyone. Of course, we're updating on COVID-19, and you're listening to Michael here at Depictions Media. The U.S. now has more cases in the world than anybody else. It is a close call, with the U.S. having 81,378 cases and numbers still climbing, versus China with 81,285 cases and Italy having 80,539 cases. It would seem that New Orleans and Louisiana seems to be climbing the fastest in the United States right now, with the military making makeshift morgues and then turning a convention center into a hospital ward. I have a report here from NBC correspondent, and we'll play that for you now.
The city that never sleeps, but right now, New York is in an unprecedented viral slumber. Soldiers piecing together a massive temporary morgue. The grim project, evidence, conditions at the epicenter of this U.S. pandemic have gone from dire to desperate.
If 1% of the population were to succumb, that would be an event that would dwarf 9/11 by orders of magnitude.
Hospitals now more like wartime triage units.
It feels like we're being sent into battle without the weapons that we need to win this war.
As the invisible enemy in that battle marches across the country, more than 75,000 infected, more than 1,100 dead. 4 weeks after Mardi Gras, when the virus was likely spread, Bourbon Street is boarded up. The convention center shifting to a makeshift hospital ward, New Orleans bracing as an explosion of positive tests indicate the virus could be spreading faster in Louisiana than anywhere else in the world.
We have not yet seen the peak of this, and unfortunately, if the worst estimates are correct, we're going to see many, many more cases.
Tens of thousands of cases, with millions across the country now wondering if their community could be next. Jay Gray, NBC News.
Of course, after a report like that, it makes some of what Justin Trudeau has put in place with the Quarantine Act and other measures to ensure that people actually self-isolate when returning to the country, or to isolate themselves if they think they are becoming symptomatic. This is a truly important thing, and let's listen to what Justin Trudeau has to say about this, in pointing out its importance.
Bonjour tout le monde. Hello everyone. Hier, notre plan d'urgence pour venir en aide aux Canadiens a été adopté par le Parlement, avec des mesures encore plus généreuses qui vont aider encore plus de gens. On parle maintenant de 107 milliards de dollars pour les travailleurs, les familles et les entreprises qui traversent des moments difficiles à cause de la COVID-19. On introduit maintenant une seule prestation, la prestation canadienne d'urgence, pour aider les travailleurs qui ont perdu leur revenu en raison de la pandémie. Que vous soyez admissible à l'assurance emploi ou non, cette prestation est là pour vous aider. Les gens recevront 2 000 $ du gouvernement fédéral à tous les mois pour les 4 prochains mois. Nous allons lancer un portail en ligne le plus vite possible pour que vous puissiez présenter votre demande rapidement et recevoir de l'argent dans les 10 jours qui suivent. Yesterday, our plan to help Canadians save jobs and support our economy was adopted by Parliament. With more generous measures to help even more Canadians, we're now talking about $107 billion to support people and businesses. We launched the new Canada Emergency Response Benefit, which will provide $2,000 a month for up to 4 months to people who are not getting paid as a result of COVID-19. This will replace the 2 benefits we announced last week to make it even simpler for you to get help. An application portal will launch as quickly as possible, and people should start receiving money within 14 days of applying. As part of this plan, we'll also be boosting the Canada Child Benefit for families in May. Parents already know how much the CCB helps with the cost of raising kids. By increasing the CCB, we'll put even more money in the pockets of families to help them navigate these uncertain times. We'll also be supplementing the GST credit, which is sent to low-income Canadians every few months. And for people who are still paying off their student loans, we're putting a 6-month interest-free moratorium on their Canada student loans. You can find more information on what else we're doing and how to access your benefits at canada.ca. I'm sorry to say there appears to be a text scam going around on the new emergency response benefit. I want to remind everyone that the government's website is the best place to find reliable information on everything we're doing. Vous pouvez consulter le site canada.ca pour obtenir plus d'informations sur ce que fait notre gouvernement pour contrer la COVID-19 et sur la façon d'accéder à vos prestations. Malheureusement, certaines personnes ont reçu un message texte qui semblait venir du gouvernement à propos de la nouvelle prestation d'urgence. C'est une arnaque. Je veux vous rappeler que le site web du gouvernement est le meilleur endroit pour trouver l'information fiable sur ce qu'on fait. C'est clair que la pandémie met énormément de pression sur nos systèmes de santé, sur l'assurance-emploi et sur tout l'appareil gouvernemental, mais sachez qu'on fait tout ce qu'on peut pour raccourcir les délais. Je sais que les factures s'empilent pour les gens et la pression monte. Ça inquiète bien des familles et avec raison. Mais on travaille le plus rapidement possible pour mettre l'argent dans vos poches. On sait aussi que les gens à l'étranger ont encore de la misère à trouver des vols pour rentrer chez eux et on continue de travailler avec les compagnies aériennes pour les ramener au pays. Hier, Air Transat a annoncé 2 autres vols partant du Salvador et de Guatemala à destination de Montréal. En même temps, notre gouvernement est en constante communication avec nos partenaires internationaux qui font eux aussi face à cette crise. On regarde ce qui a fonctionné ou pas pour eux et on essaie de voir si on ne pourrait pas s'inspirer de leur succès. Earlier today, I spoke to G20 leaders. One thing is clear. We can only overcome COVID-19 if we take action together as a global community. So we're going to do whatever it takes. That means making sure the World Health Organization and our public health agencies have the resources they need. It means working together to develop a vaccine, identify treatments, and increase testing. We're also expanding manufacturing capacity for critical medical equipment and working to keep the supply chains moving to get that equipment to the people who need it. Our government is helping companies in Canada retool their manufacturing facilities to produce the things we all need. On the economy, the G20 has also made significant investments to help people and businesses get through this challenging time. And we're going to be working closely together to coordinate our efforts to protect the global economy. COVID-19 is a global crisis and demands a global response. Now more than ever, we must work with our allies to protect people and the economy. And on that note, I announced this morning that I'm appointing Kirsten Hillman as our new ambassador to the United States. Ambassador Hillman is a gifted and brilliant diplomat. She was instrumental in securing a good deal for Canada and for Canadians during NAFTA negotiations. Most recently, Ambassador Hillman played a key role as we worked with our southern neighbors to temporarily close the border while keeping trade flowing. As we fight COVID-19, we must protect the supply chains on which we depend for things like fresh vegetables, medicine, and supplies for our healthcare systems. Our ports, railways, and trucks are vital to bringing in the things we need, and I want to thank all the workers who are keeping our country moving. Every day, our government looks at what we need to do better to help you and keep you safe from this evolving crisis. So in response to the fact that too many travelers are still not self-isolating upon returning to Canada, we're taking greater action. I've been very clear on this. The premiers, Dr. Tam, and public health officials have all been very clear on this. If you've just returned from abroad, you have to go home and stay home for 14 days. But some people have not been taking this seriously. They're stopping by the grocery store on their way home from the airport. They're getting together with friends after being away for March break. This kind of conduct is not just disappointing, it's dangerous. So now, a 14-day quarantine will be mandatory for all Canadians returning home from abroad. We are implementing the Quarantine Act to keep all Canadians safe. If you do not comply with these instructions, you could face serious fines and even prison time. C'est absolument essentiel que tous les voyageurs se placent en quarantaine pour 14 jours lorsqu'ils rentrent au pays. Ça fait des semaines qu'on le répète, mais certains ne semblent pas prendre nos recommandations au sérieux. C'est non seulement décevant, c'est dangereux. On va donc rendre l'isolement obligatoire en évoquant la loi sur la mise en quarantaine. Si vous refusez de suivre les instructions, vous pourriez recevoir une grosse amende ou même écoper une peine de prison. On a tous un rôle à jouer pour freiner la propagation du virus. Ce qu'on vous demande, c'est pas compliqué. Restez chez vous. Lavez-vous les mains. Gardez vos distances. Appelez vos amis plutôt que d'aller les voir. Et surtout, si vous retournez de voyage, vous ne pouvez en aucun cas sortir de la maison pendant 14 jours. On a tous hâte que la vie reprenne son cours, mais pour ça, il faut absolument que tout le monde fasse sa part. Merci beaucoup.
As we heard, the federal government is still trying to roll out plans to help people, plans and programs to help people keep afloat and keep a roof over your head, keep food on your table, and so forth, as well as programs to ensure that people get the care that they need if they become sick. So with that, we're going to move on to a segment about the 211 service for seniors, so that seniors can get volunteer care for things like grabbing groceries and virtual visits, because as you know, here in British Columbia, the seniors' homes are locked down. You are not going to readily be able to visit your elderly grandparents or parents, especially they're in a care home. They're just not letting people in to visit and things like that, because of the idea that you could be carrying, even on your clothes, something to get somebody sick. And they need to make sure that we ensure that all the beds are available for other people on the outside for care. So 211 is an answer to that. If you want to volunteer, you can call 211, and if you know of a senior who is in need, you can also call 211 for them and help get them help. Okay, so let's play that clip from Adrian Dix. Here we go.
Please come. Thank you. Good afternoon. I'm Adrian Dix, BC Minister of Health. I'm honored to be here on the territory of the Lekwungen-speaking people of the Songhees and Esquimalt First Nations. To my right is Isabel McKenzie, BC Seniors Advocate. And I just want to give you a sense of what the media and the public can expect in terms of briefings over the next couple of days. At 3 o'clock, I will be briefing along with Dr. Bonnie Henry, and I will be briefing at 3 o'clock. And so questions relevant to the overall COVID-19 response and issues around that can be dealt with at that time. We're making a specific announcement today with respect to seniors in community. Tomorrow morning at 10:30, Dr. Henry and I will be here for a media briefing around issues around modeling. And there will be a pre-briefing for members of the media starting at 9 o'clock tomorrow morning. So that's what you can expect in the days to come. And as I say, questions relevant to questions related to the overall response for Dr. Henry or myself can wait till 3 o'clock today. Most seniors live at home. We know this. We've taken very strong measures and will continue to take strong measures to support seniors living in long-term care, seniors living in assisted living, but a very significant number of seniors live at home, and these are challenging times for seniors living at home. We have throughout BC, and we have a network of organizations and volunteers in community that support seniors in community living at home, and those networks as well have been stretched in recent times. So last week I convened a committee that has done extraordinary and rapid work to put together a response to assist seniors living in community and also to harness in the safest way possible the enormous desire of British Columbians to support their neighbors, their friends, their communities. I get contacted every day by people who want to help and who are engaged in helping, and that is an inspiring thing in difficult times. So last week I convened a group co-chaired by Isabel McKenzie, by Terry Collins, an outstanding public servant in the Ministry of Health, and involved 5 members of the legislature. Ronna Ray Leonard, who's the Parliamentary Secretary for Seniors, Shirley Bond, MLA from Prince George and former Deputy Premier, Janet Rutledge, an MLA from an NDP MLA, a government MLA from Burnaby, John Yap, an MLA from Richmond, and the Green Party House Leader, Sonia Furstenau, with the idea of developing together under the guidance of Isabel McKenzie, a program that would help seniors who are living at home, seniors in community. On Monday, as all of you know, in her update, her economic statement, Finance Minister Carol James announced there would be $50 million in new support for Better at Home programs for the United Way, whose Better at Home program engages 68 community organizations across BC, 24 of which are involved and will be involved in COVID response. And so this work that people came together and have done is extraordinary work, and Isabel McKenzie will be speaking to it in a minute, but it reflects, I think, the commitment of all people, and I want to thank all 5 of the MLAs, the team at the Ministry of Health, and in particular Isabel, for their involvement, for the speed in which they've moved here to provide some additional supports to address issues of isolation that occur. Because as we all know, people often, especially seniors, need to stay home to stay safe. But they need support in doing that. We can't let social distancing become isolation. And that is part of what we're trying to achieve today. So with that, with the details of the program, and just to put it in context, the person who will be in charge, Isabel McKenzie, the other person in charge, Terry Collins, the board of directors will be the MLAs from all parties and from many regions of the province. Will be announcing our program, and this program to assist seniors living in community. I'd like to welcome Isabel.
Thank you very much, Minister Dix. I'm Isabel McKenzie, Seniors Advocate for the province of British Columbia. As you know, on March 8, 2020, BC declared a public health emergency due to the COVID-19 outbreak. And I know that people across British Columbia are anxious and they're worried about their health, about the health of their loved ones, and about what the future holds. Seniors are especially worried about COVID-19. It is particularly serious for the elderly people and those with underlying health conditions. The Provincial Health Officer, Dr. Bonnie Henry, is asking all British Columbians to stay home, to self-isolate as much as possible, and when it is necessary to go out for essential activities, to stay at least 6 feet away from other people, and to not go out at all, even for necessities, if you are feeling at all unwell. These measures are vitally important as we try to protect our vulnerable seniors. As Dr. Henry reminds us, it's not just about you getting sick. It's about bringing the infection home to your family. And this could include your mom, your dad, your grandma, your grandpa. Most of us are following Dr. Henry's advice, and seniors want to do the right thing and want to stay at home, but they're going to need our help in order to do this. Within a matter of weeks, things have changed drastically for all of us. They continue to change as we implement more safety measures each day to protect all British Columbians. And it's clear COVID-19 will not be with us forever, but it will be with us for some time. If we put ourselves in the shoes of a senior, we can begin to understand the additional challenges older adults will face in responding to COVID-19. Seniors are most at risk of COVID-19 and the seriousness of this virus, and they are frankly afraid that if they get it, they will die. They are also more likely to have complicated health issues, more so than most of us, and they're worried about whether they'll receive the care for those health issues while we're focused on the battle with COVID-19. Many seniors rely on friends or family, neighbors, to visit them, shop for them, pick up their medications, make them some meals, and drive them to medical appointments. This support network that provides many of the essentials that allow seniors to continue to live independently in their own homes has been strained by the COVID-19 restrictions. And seniors are overwhelmingly more likely to live alone. And they are less likely to be plugged into the social networks of FaceTime, Skype, and Zoom. And that's why we are here today. As Minister Dix has spoken of, I've been working with the Ministry of Health, my colleague and co-chair Terry Collins, and an all-party legislative committee of MLAs on ideas of how we can better support seniors during this pandemic. While we know there are many seniors who are at added risk for COVID-19, we have also seen an amazing outpouring of community support as it becomes clear we're all concerned about the elderly in our communities. All over this province, every hour of every day, people are stepping up and reaching out to the seniors they know. They're offering to get their groceries. They're taking time to give them a call. They're dropping off some dinner. Many businesses are showing they too are concerned and are responding with dedicated shopping times and increased delivery capacity. To all of you, I say most profoundly, thank you, and keep on doing what you're doing. However, my office, as well as MLA offices throughout the province and other offices, are being flooded with calls of people who want to help seniors. We're also getting calls from seniors and worried family members outside the province and in different communities from where their mom and dad live about how they can cope and what help there might be. Connecting the people who want to help with the people who need help is going to be a key strategy in meeting the needs of seniors in the coming weeks. And together we have come up with a way to do this. The government has provided the necessary funds to expand BC 211. It's a 3-digit number, 211. You can now call it from anywhere in the province and you will reach a live operator. It's backed up by a website, BC 211. And they will manage calls from people who want to help as well as people who need help. So the message is simple. Wherever you live in BC, if you want to help seniors with virtual visits, picking up and delivering some groceries, picking up and delivering some medications, maybe dropping off a meal or two, call 211 or visit the website. And we'll try to match you up with a senior in your community who needs help. If you are a senior or the family member of a senior who needs help, getting groceries, getting their medications, staying connected, call 211 or visit the website. And we'll try to match you up with a volunteer or some kind of service in your community that will provide the help you need. In addition to the expansion of BC 211, the government has also increased funding to the Better at Home program significantly. And it's delivered by 68 different community agencies all across BC. They're getting additional funding to ensure that the core Better at Home services can meet the COVID-19 challenge. And 24 of these agencies have been designated as COVID response agencies. And they will be resourced to meet the new demand from the increased number of volunteer and client screening and matching processes that will happen. They will cover all of British Columbia. So after receiving a referral from BC 211, Better at Home will work to match seniors with volunteers and to support them through the COVID-19 crisis. Services available right now to seniors include meal delivery, help with cooking, delivery of groceries and medicines, wellness checks, calls, and visits. These supports will go a long way in helping seniors stay safe at home and to relieve the anxiety and worry that many seniors are feeling. My message to BC seniors is simple. Please do not be afraid, but please stay home and let us help. We want to help. Your kids, your grandkids, your community, every one of your elected officials at every level of government want you to be safe, and we are here to make sure that you're supported. Please, let us pick up your groceries. Please, let us get your medications. Please, let us give you a call each day. Please, let us know if there's something you need. Let us drop off dinner. If you're one of the tens of thousands of seniors who are normally the ones volunteering and helping, give 211 a call. You can help out with virtual visits, virtual calls. But please, now is not the time to be out and about in your community. You can help us all by letting us help you. It's not forever. It's for now. If you need help, call 211. If you can help, call 211. I would also ask that in showing our kindness to one another, we also show a little patience as we roll out this program. Significant capacity has been added, but this is uncharted territory. If you can use the website, please do so, and know that we are monitoring call volumes and will try to make necessary adjustments. We simply don't have the luxury of time that is necessary for perfection. And now I'll turn it back to Minister Dix, or I am open to any questions.
Okay, so our next clip will be from Adrian Dix and Bonnie Henry. British Columbia is now over 700 people with the COVID-19. 66 cases were added overnight. We are still on a steep curve, according to health officials, on new occurrences of cases. That puts our healthcare system in jeopardy when we still have a steep curve. That's why they keep talking about the self-isolation and the self-distancing and just trying to stay within at least 6 feet of each other so that we don't infect each other. There's a whole bunch of other campaigns where they state this, some sayings and everything. Did you hear Bonnie Henry say something along the effect of we're working together by staying apart? So we'll play that clip. There's also Adrian Dix is going to mention something about they've added new staff to help traffic calls on 811 so that wait times are lower and more people will get through on the calls when they need help from these nursing lines. Okay, so let's get on to the clip with Adrian Dix and Bonnie Henry.
Thank you. Good afternoon. So a couple of things on the agenda for today, but first off, we have had 66 new cases in the last 24 hours, bringing our total up to 725 here in British Columbia test positive cases. That includes 359 in Vancouver Coastal Health, 241 in the Fraser Health Region, 52 here on Vancouver Island, 62 in Interior Health, and 11 now in the Northern Health Region. As you are aware, we have 9 long-term care facility outbreaks that are ongoing. There's no change in that number today, and all of the stats stay the same with the exception of the 2. One, the Lynn Valley Care Centre, we've had an increase in 4 residents and 3 additional healthcare workers who have tested positive. And in Harrow Park, we have an increase of 2 residents and 1 additional staff member who's tested positive in that outbreak. All of the others continue to be investigated and managed. Of our 725 cases, we now have 66 people in hospital in BC, and of those, 26 are in the intensive care unit, and 186 people are fully recovered. We have no new deaths today, thankfully. A couple of things that have come out in the last day or so. One, of course, is one that you may have heard of. We have new prescriber guidelines to support people who use drugs and people who have issues with substance use disorder or addictions. And this is particularly to support people in places like the downtown east side who may be affected by COVID-19. And so these guidelines are to enable us to provide a safe supply for people and to ensure that they're able to comply with our public health advice around isolation or quarantine should that be required. So I think that's a very important piece to help ensure that we can support people in those situations as best we can. In addition, I mentioned in yesterday's briefing, I've made 2 additional orders under the Public Health Act in BC. One is enables health sector workers at all public and private facilities to remain at one facility only for the duration of the pandemic. This includes long-term care, assisted living, extended and acute care. So this is one of the key things that we've talked about as being a risk, particularly for our more vulnerable elders and seniors who are in care homes or in assisted living, where we've had a patchwork system of care providers, healthcare workers of various different kinds who move between facilities. And that is one of the things that has facilitated movement and outbreaks in a number of different facilities, unfortunately, so far in British Columbia. So this will be really important to help support those workers to be able to work and to maintain the support that we need in those facilities with decreasing that risk. So decreasing the potential for transmission both between healthcare workers but also, most importantly, between facilities. The other thing that was announced earlier this morning, which you would have heard, is that Minister Farnworth has come out with a number of enhanced provisions and made it quite clear around the provincial emergency declaration under the Emergency Programs Act. And I'm really pleased that he has done some things that have defined essential work for the province, and this will help clarify things. As I know, a number of different municipalities were looking at different definitions of who essential workers were and what types of essential services we needed. As well, there are enhanced powers to enforce the orders that we have in place in British Columbia, whether they're orders for isolation, quarantine for people who have returning travelers. And along with that, the Government of Canada has now determined that they are going to use the Quarantine Act to enforce a 14-day quarantine for all travelers entering Canada. So that became effective as of last night, and we are and will be working with them to ensure that we can align our enforcement of these orders if needed. And I think it's, we've said before, although it was an expectation at the provincial, at the federal level, it has been an order for people here in British Columbia, and we have had good compliance with this order, although on a couple of occasions we've needed to enforce it. So every day that we stay home, that we do what we have been asked to do, where we stay apart but staying connected, brings us a day closer to being able to manage this response. There are still many, many things that we can do and we should be doing together. We can connect with friends online, we can share stories about our day, we can share pictures, we can share videos, we can have celebrations together virtually, and there's lots of those that have been examples lately of people having birthdays where their community can celebrate without having the physical connectedness that puts people at risk. We can all make a difference, but we need everyone to be 100% committed to doing this. That doesn't mean 100% of people all have to stay in their house, but each and every one of us needs to right now make that commitment to stay away from people who are vulnerable, to stay at home when we can, to go out for our essential things only, to make sure that we are able to provide those essential services. If you're a healthcare worker, if you work in a grocery store, we're depending on you, but we need you to do that safely, and that means maintaining the physical distance between people. But we also need to continue to come in together as a community and to do that virtually. So we need to take care of each other right now. We need to be kind, and we need everybody to do their part.
Thank you very much, Dr. Henry. As Dr. Henry has said, we now have 725 confirmed cases in British Columbia. That's up 66 from yesterday's report. 66 people, the same number, are currently in hospital, and that's an increase of 2, and 26 people currently in ICU. 14 people have died from COVID-19 in British Columbia. I wanted to update on a couple of facts that are occurring out there. First of all, I want to thank the incredible team of patient navigators and nurses at 811. For the first time yesterday, we answered, calls answered 5,070, and the average wait time yesterday was 5.3 minutes, which reflects the extraordinary number of both new staff and the commitment of those staff that we've seen at 811, which is enormously helpful to people as they deal with both the anxiety around COVID-19 and the reality of feeling sick in BC at a difficult time. I wanted to note as well, and this is of interest, I think, to people. We now have more registrants in BC. People have come back and registered as doctors and nurses, 26 doctors and 248 nurses. And as well, we have many care aides who have joined and rejoined in support of healthcare facilities in BC. And all I can say, I don't want to speak for Dr. Henry and the Premier and the whole government, is how much we appreciate how much that demonstrates our shared commitment and the extraordinary commitment of all healthcare workers to the care of people in BC. Finally, I wanted to note that we have as of As of March 26th, as of today, 3,903 total beds vacant in the acute care system in BC, that the current occupancy is 63.6% overall. The current occupancy of critical care beds is 54.8%, which is pretty consistent, and the total vacant critical care beds are 371. Tomorrow will be Dr. Henry and Stephen Brown and myself will be providing some briefing on what we've described as modeling, which is to let people know some of the models of what could be expected in BC, including what we see based on BC data, but also taking worst-case scenarios. So what you're going to see tomorrow is our preparations in the face of what could be worst-case scenarios in BC in comparison to places such as Chile and Italy. There's obviously been a lot of concern and talk about so. How are we managing that? Well, by conserving and micromanaging our existing inventory, and there's a number of steps we've taken to do that to ensure that the equipment is there and in place and prepared and can be moved around quickly for the needs of our teams and our staff. And finally, securing supply and sources of PPE. We have received, and we are that what we do today matters. Physical distance and self-isolation and everything Dr. Henry is telling us to do matters. It matters today, and it matters for the days, the weeks, and the months ahead. This will be a difficult time, as difficult as we've ever seen as a province. But we know this: if we do what we're asked, if we do what is right, we can take the steps we need to bend the curve to ensure that all of us have the resources to deal with this really unprecedented in our lifetimes public health emergency. The action we take today matter, and you'll see this tomorrow as well. They're what will help us help save the ones we love, perhaps, tomorrow. Working apart, we're standing together. The distance between us unites us. I've said it before, and I'll continue to say it. Dr. Henry just said it to you. We need 100% of us to be all in, 100% of the time. And in the days today and all the days and weeks ahead, we have to work 100% as a whole society, from each individual in every community, in every corner of BC, to the provincial government, to the federal government, to the municipal governments. All of us have to be all in to do what we can to defeat COVID-19. And with that, I'll take your questions. Oh, wait, one more thing. Just a few words in French. Nous avons 166 nouveaux cas de COVID-19 aujourd'hui, pour un total de 725 cas en Colombie-Britannique. Chaque régie de santé de la Colombie-Britannique compte des patients atteints de COVID-19. 359 se trouvent à Vancouver Coastal, 241 à Fraser, 52 sur l'île de Vancouver, 62 dans l'intérieur et 11 au nord. 9 établissements de soins de longue durée dans le régime de santé de Vancouver Coastal et Fraser ont confirmé des cas de COVID-19. Les responsables de la santé publique offrent une solution pour mettre en place des protocoles d'épidémie. Des ordonnances de l'agent de santé provincial pour les employeurs des secteurs de la santé publique et privée et les établissements de soins de longue durée ont été mises aujourd'hui. Ces ordonnances garantissent que les employés travaillent dans un seul établissement pour réduire le risque de transmission de COVID-19. Je vous remercie and we're happy to take your questions.
Okay, this next segment, unfortunately, I can't actually really play it for you because it is total video with text over it. It is coming from the new social media site TikTok, and the user is tallgirl42069. And her brother has autism, and he's just so used to getting his Starbucks, and it's just simply not available. As we know, most of the Starbucks have closed or takeout only, what have you. So getting him his Starbucks drink is probably a little bit problematic. But I'm going to read to you what the text says. And let's start this. So my brother, who is autistic, loves Starbucks, and he has been getting special chocolate smoothie from Starbucks almost daily. But his Starbucks recently closed due to COVID-19, and changing routines is really hard for him. So this is what our mornings look like now. Okay, so basically they concoct a different smoothie, and they take him to the local playground so that he can have his morning smoothie, and it's just a really cool thing that they're trying to get. Tall Girl, the user here, is trying to make sure that her brother keeps his morning routine even with the COVID-19 lockdowns and everything. So I invite you to go to TikTok and search for Tall Girl 42069 to watch this clip. Thank you. Thank you for listening to Depictions Media Policy and Rights. I am Michael, and I will talk to you tomorrow. This show has been produced by Depictions Media. please contact us at depictions.media for more information.